We're talking about a very important topic this morning, pelvic health. And to all my ladies, especially my workout ladies that have, used to could jump a lot of rope, and then all of a sudden you're like, uh-oh, if jump ropes in the workout, we may have some things. That doesn't have to be your life anymore. All right, well, we are working on really preventing any issues before they have. We've got Dr. Stephanie Morgan here with Limitless Pelvic Health. And you've been doing, the physical therapy for about 10 years and really focusing on the pelvic floor for the past 7.
Yes, yeah. I tell people that we're glorified physical therapists. We just happen to specialize in a different region of the body.
Yes.
So we can assess anything that attaches to the pelvis and that lies within the pelvis. And that's so important throughout the lifespan, not just for young folks or older individuals, but it can be throughout the life.
And I think so many women, especially, my age, just thought, well, you have some kids, you're getting older, you just have to live with this. Yeah. And you're saying, no, you don't.
No, I tell people it's common but not normal. So we're trying to find things that are preventative care for later on in life. So that could mean simply before pregnancy or during pregnancy, postpartum life, but preventing those things down the line is just, it's women's advocacy, it's women's health, and we're just trying to catch it sooner so that we don't have as many issues down the line.
Okay, let's talk about the customer that comes to see you or the patient that comes to see you. Why are they even coming into your doors?
Yeah, so we see a lot of folks who have bladder dysfunction, bowel dysfunction, sexual dysfunction, a lot of folks we see during their pregnancy and postpartum, and that's where I kind of like to relate to folks is because I have 2 children of my own, and that's why I got into what I'm doing.
Right.
So I want people to get back to their normal or to feel like things are normal for them without having any barriers when it comes to their physical health.
And what is normal? Because after a while you kind of forget and you're just like, oh, this is my new normal.
Yeah, and I think it's about polishing what your goals are.
Yes.
And trying to get back to just simple exercise, getting back to walking. Some people have goals of getting back to running. So what goes into that is a lot of more personalized care, and that's what we do as pelvic health therapists is just look at the whole body, look at the core, look at the glutes, look at the pelvic floor, but also how well do you move and what does that look like baby, but also postpartum as well.
And let's talk about because some of the little ones that I would think would be, little or more annoying is like we were saying, the jumping, and then all of a sudden you have to use the restroom a little bit. Is that is there stuff that's more severe that could actually cause problems?
So we see a lot of people who do have that urinary leakage with jumping, coughing, laughing, sneezing. It's probably the most common thing that we see is stress urinary incontinence, but that can lead into issues related to vaginal pressure or even pain related to that area. So again, if we catch this sooner, then I think we prevent things down the line. But what I think that people want to know is that things are right down there, but also that they're doing things correctly and they're not going to hurt themselves down the line.
I love it. And I guess you can check, and we have a special right now for people to set up a consultation. Tell us about that.
So we are doing a special for a $67 initial evaluation for pelvic floor therapy. And again, sometimes 1 to 3 visits just to show you where you are and what your goals are and how to get there goes a long way. So we do a full assessment. I say external to a potential internal exam just to know if things are working like they should and how we can get you to reach those goals.
I love it. Tell us how we can get in touch with you and where you're located.
So we have 3 locations, one in downtown Greenville on Toy Street, one in Greenville off Woodruff Road, and then a location in Spartanburg at the Labors of Love Midwifery Birth Center. And so you can give us a call at 864-251 and follow our website there, and you can call and talk with Anna or Jordan about an initial consult and get set up with either myself, Dr. Stephanie Morgan, or Dr. Katie Fincher.
Thank you, Dr. Morgan. This is great. Katie's been on before. Y'all have a fantastic team, so we appreciate you
so much
doing this.